For over 100 years, doctors have diagnosed acute infection by looking for an offending organism, but the process is far from perfect. Whether using a traditional culture or a newer molecular pathogen test, positive results can help with the development of a treatment plan, but can also be the result of contamination by native bacteria. Furthermore, most blood culture results are negative, even in patients with infections, as most infections don't enter the bloodstream. Thus, positive results can be less than definitive, and negative results can leave many questions unanswered. Is there an infection causing the patient's symptoms? If so, is it viral or bacterial? And how severely ill is this patient? At Inflammatix, we've realized that Mother Nature has already evolved the perfect diagnostic, the immune system. By figuring out how to read the immune system's responses, we can provide clinically actionable results quickly enough to fit into an acute infection and sepsis workflow. Our INSEP Acute Infection and Sepsis Test can guide physicians on whether a patient has a bacterial or a viral infection anywhere in the body, and how severe it is. Armed with this information, physicians in an emergency room or ICU could more confidently decide which treatments and additional diagnostics are necessary. The INSEP Acute Infection and Sepsis Test promises to give physicians the confidence to avoid unnecessary antibiotics, reduce unneeded patient admissions, and discharge patients safely. The power of the Inflammatix platform comes from our state-of-the-art bioinformatics approach, which combines transcriptomics-based biomarkers with robust, proprietary computational algorithms. By measuring the relative amounts of mRNA from carefully selected immune-related genes, our neural net-based algorithms generate robust, best-in-class diagnostic classifiers. The INSEP Acute Infection and Sepsis Test will run on rapid point-of-care or near point-of-care diagnostic instruments. To learn more about our host response approach, clinical study opportunities, or how HostDX tests can be run on rapid molecular diagnostic instruments, contact us by emailing info@inflammatix.com.